Quokaz Nation, we are back with another hot take. This one, I'm not going to take up too much time here. I want to speak to something that's been irking me of late. I was sitting in a meeting not that long ago, and one of the members at the meeting was just highlighting a bunch of issues that couldn't be solved. Oh, we can't deal with this within the healthcare system. We can't deal with that. And no solutions were coming to the table. And maybe I was a little bit edgy because I was sleep deprived. But at the end of the day, if you're if you got a seat at the table, bring some solutions forward. Don't just be that guy that's, oh, this isn't going to work. That's not going to work. We're not going to be able to solve this problem. We can't solve that problem. Instead of being all, yes, you're going to need some realism to a lot of these ideas, but add some solutions. Add a perspective of saying, like, this is an issue, but this is how we can overcome these concerns. I'm tired of people showing their worth by putting all these ideas down, by being the naysayer. And once again, you're going to want diverse opinions at your table, but to have that volume of this ain't going to work, that ain't going to work, especially in a time of crisis, to me, your value isn't there. So this is my push for healthcare professionals, healthcare leadership, is that ask more from your staff. Ask more to say, okay, maybe this solution will cause some strife within another department or what have you. But I want to hear how we overcome that. I want you to think hard about how we're going to address that and not just come up with why this and that's not going to work. To me, we're beyond that now. It's solutions, and it's creative solutions. And healthcare leaders, you've heard me say this, you got to create an environment where people feel safe to open up about their ideas and not feel rejected and be able to be vulnerable enough to put out some ideas that maybe have some judgment associated with it. But this is the time. Create that environment where people feel safe to open up. And you've heard me, some of you have heard me say, like, how do we come up with these creative solutions? I gotta say, one of the concepts that we talked about, we workshop on, stemming from the book on apologetic leadership, is integrative thinking. Like, when you have, I'll just use privatization. I know it's controversial. Private healthcare as an example. When you have, when you're looking to improve, say, surgical wait times, instead of saying, oh, we got to be private or we got to be public and work just within those systems, ask yourself, what are the best aspects of publicly funded system? And what are the best aspects of the private healthcare system? And how can we integrate them? What can we use? How can we take the best out of the best? As an example, if you got a private company that is hustling, putting out surgeries like crazy, way more efficient, maybe we use public dollars to help fund those. We use public dollars to help fund surgeries at that clinic because we know we can take a stab at the surgical wait times because they're efficient. They have a system that works. Maybe we send some of our trainees to learn from what they're doing well. Some of our healthcare administrators to learn on how they work so efficiently, so we could bring it back to our own hospital or our own region. Like, thinking outside the box, to not have the black and white thinking, creating an environment where people can think outside the box, but also, if you are a leader, if you do have a seat at the table, not just bringing that Debbie Downer energy, not just saying why this and that's not going to work. Bring solutions. It's your duty. It's your job, and it's a time when we need it the most. All right, that's all I got to say. Thanks for listening, folks. Y'all are the best.